leaders. This is a session in which us, the young people, can engage with our global leaders of today, and it is a platform for us to discuss, a space for us to share our post-2015 priorities, a space for us to share our recommendations as they pertain to the RMNCH, as well as strengthening the role of youth in improving RMNCH, as well as recommendations in which we can make to the PMNCH. So as you can see, we chose a very comfortable room because this is not a serious discussion. It's just a place for us to really highlight the issues. Nobody has to be afraid of criticism. This is just a place for us to just come over and discuss the real issues that are happening. So for this morning, we're honored to have several people here with us. They'll be part of our panel discussion and the leaders. We have Dr. Margaret Chan, who is the Director General of the World Health Organization, and over the last couple of years, she has done remarkable work in addressing communicable diseases. She has launched services to prevent disease and to promote better health, including the commitment to universal coverage. We have Ms. Amina Mohammed. She is the Secretary General Special Advisor on the Post-2015 Development Planning. She has worked in coordinating debt relief funds of MDGs in Nigeria and has served as coordinator of the Task Force on Gender and Education. We have Ms. Kathy Calvin, who is the President and CEO of United Nations Foundation. She is a passionate advocate for multi-sectoral problem solving, U.S. leadership on global issues, and the inclusion of women in all sectors. We have Dr. Carole Presern. She is the Executive Director of the Partnership for Maternal, Newborn, and Child Health. She has worked for many years overseas in health and development, and we all remember we met her yesterday. And we also have Ms. Kelly Thompson, who's from IFMSA. She's the Liaison Officer on Reproductive Health, including AIDS, and she's taking off her final year of medical school to work on the post-2015 in New York. And joining us soon will be Professor Babatunde, who is the Executive Director of the United Nations Population Fund. And we all know he has introduced major reforms to intensify efforts to improve sexual and reproductive health, particularly amongst young people.
Morning, everybody. My name is Fellow Jean. People have quite a challenge with that name, which I understand, and I'm from the African Women's Development and Communication Network. The acronym is IFMNET, and we are based in Nairobi. So yesterday we had a very robust discussion of some of the issues that are coming up in the post-2015 discussions, and we felt that the recommendations that have been made for the post-2015 agenda represent youth in a suboptimal manner. And we believe this is also because the youth engagement has also been done at a suboptimal manner. And so that's why we are having this dialogue, just to present our issues, and hopefully as advocates you can be able to voice them and be able to be reflected in the post-2015 agenda. So this was the outcome document. We, the youth, meeting at the 3rd PMNCH Partners Forum, taking place in Johannesburg, South Africa in 2014, recognized that health populations, and particularly women, children, and young people, are at the center of sustainable development, and that increasingly evidence shows that health and well-being in adolescents shapes the entire life course of individuals. Congratulates the progress made towards achieving the MDG goals 4 and 5, but note that more remains to be done, can and should be done, especially with regards to addressing sexual and reproductive health and rights. Recognize that the progress that has been made has often been inequitable, leaving behind marginalized groups, particularly within the diverse group that we call youth, shaped by geographic location, ethnicity, race, physical impairment, sex, indigenous groups, people with disabilities, diverse sexual orientation, and employment status. Note that improving adolescent and youth health and well-being will require a human rights-based, multi-sectoral approach that ensures appropriate education, safety, empowerment, employment, and gender equality. Note that it will also require a multi-stakeholder approach that promotes appropriate policy and investment in the youth health program and is supported by functional accountability at all levels, from subnational to the global region. Reinforce the need for meaningful youth engagement and leadership in designing, implementing, monitoring, and evaluating programs aimed at improving health outcomes and in holding partners to account. Thus, we commit to and call on members attending the PMNCH Partners Forum to within their efforts to accelerate progress towards the achievement of the MDGs as well as support the incorporation into the post-2015 agenda. These are the items that we have recommended. Fulfill the sexual and reproductive health and rights of young people by ensuring comprehensive sexuality education, access to modern contraception and safe legal abortion services, and appropriate pregnancy-related services. Ensure a universal access to quality-assured, comprehensive adolescent and youth-friendly health services and information without user fees, which include integrated sexual and reproductive health, HIV, universal access to testing and treatment, mental health, including early detection services. Integrate equity considerations in youth health programming with a view to removing barriers. Integrate equality considerations in youth health programming with a view to removing barriers that marginalize and vulnerable groups, including LGBTQI, refugees, migrants, people with disabilities, those out of school, young people in prisons facing accessing care. Increase investment in health promotion and prevention programs for adolescents and youth aimed at reducing risk of non-communicable diseases, including tobacco use, obesity, as well as harm reduction programs for drugs, including alcohol. Increase investment and work in an intersectoral manner in the social, political, and environmental determinants of young people's health, especially secondary education, youth employment, nutrition, security, social exclusion, including income equality, sexual diversity, gender equality, participation, and representation. Invest in eliminating gender-based violence, including harmful and unethical practices affecting young women and girls, including early and forced child marriage, girl pledging, and female genital cutting. Take action in improving road safety and implement policies that aim at preventing injuries and deaths due to interpersonal violence. Actively engage youth as equal partners in the design, implementation, and monitoring of health programs and policies at all levels. Tackle issues of institutional violence, such as poverty and neglect that adversely affect young people. Invest in acquiring better data on youth and adolescent populations. Involve religious and traditional leaders and influencers and faith communities in challenging harmful gender norms that promote negative aspects of SRHR. Document and share best practices to improve youth and adolescent health outcomes. Lastly, we call on the PMNCH to include a commitment to the principles outlined in this document within the Partners Forum community. Thank you very much.
That document really reflects what we discussed yesterday in terms of just what the youth need and how we really need to be integrated into this post-2015 agenda. At this point, we'll go on to our panel discussion. I have several questions targeted to specific people from the discussions that came about yesterday. And we will ask you to please answer in 3 minutes so that at the end we have more than enough time for the group to be able to ask questions and to have an interactive dialogue. So the first question is to Ms. Kathy Howard. We know that UNF has scaled up its youth-related activities, particularly around promoting youth leadership, which has been identified by youth as a critical space for investment by IFMSA and development partners. In your opinion, how can we promote more effective youth advocacy as it pertains to the post-2015 development agenda? We are an effective youth advocate. We are particularly interested in how partners can work to strengthen the link between global level advocacy for integration in the sustainable development goals and country level advocacy that aims at ensuring investments in youth is a national level priority.
Great. Good morning. Thank you all for that. Thanks for that excellent statement. I think you covered a lot of things, and I was really glad to see the very important emphasis on SRHR. You know, I think we all sometimes talk about young people as the leaders of tomorrow, but actually you are the leaders of today, and the world is now planning for a set of goals that's going to affect you and your lives between now and 2030. So this is the moment that you have to take charge, and I think all of us up here are recognizing that this is a partnership with you because this is the future you're building. I think there's a couple issues that we should be talking about in terms of how we think about maximizing your impact. The Secretary General himself has put a lot of emphasis on youth. He has a youth advisor. I know every single one of the agencies up here has prioritized youth. The Secretary General has even called this Gen UN, and I think that's not a bad term to think of. But I want to say that I think you have a couple extra responsibilities as young people. The first is you have to make sure your own countries are actively engaged at the table. I worry sometimes that the movement we're discussing is at a global level and everybody connects to it. You are the ones who can take it best to the local level. When I see the congressmen in our country respond, it's to the young people in their districts. You have that ability. Second, you're the carriers of a measurability challenge. You can talk about this list that's being developed for the next set of goals in terms of measurable outcomes, and those are the ones you want to hold leaders to account for. Third, I think you have an ability to link your work locally to a global movement in some very powerful ways, and we're seeing that happen all over the globe. And fourth, it's up to you to reach back to younger people. I'm looking at this room and thinking many of you were maybe 15 in 2000 when the first goals were set. How are you bringing the next generation along who should be the next set of leaders? And finally, I just want to say that the inclusion of young people should not be a secondary thought, as you all were saying today. It needs to be a partnership from day one, and it sounds like that's what you're all here to do. So thank you very much.
How, as much as it's your responsibility, it's our responsibility as well. And we always believe in intergenerational leadership. So the importance of us working together and being mentored so that we can be the best that we can be and make sure that our priorities are there. Next, I'd like to hear from Dr. Margaret Chan. You will be talking later on at a plenary about accountability for women and children's health, noting how, as you often say, what gets measured gets done. A lot has been done around accountability for women and children's health, but as a recent WHO report highlighted, much remains to be done, still when it comes to accountability for adolescents. Can you tell us what the World Health Organization can and will do to close the current gap that exists around adolescents?
Thank you for that question, but first and foremost, good morning to everyone, and especially to the organizer for inviting me to this meeting. This is perhaps the first meeting that I have ever attended as Director General of WHO in the last 7 years, where you outnumber us, the old folks. Well, at least I can say for myself, these other guys are young. Now, you are absolutely correct. The World Health Organization in May this year issued the World Adolescent Report, and it is very revealing. It tells you that there are many gaps in terms of health services, care provided to the young people. First and foremost, listen to what Catherine has said. You are the leader. You will be the ones that determine your leaders in your country. Exercise your right as an individual and vote for government that listens to you. And that is important. Now then it brings me to, I shall not cover all the gaps because in your declaration, you have already mentioned the important gaps. I always look at it. I also have a son who's much younger than me, of course. He kept...
Hopefully.
Hey, we need a joke in the morning. He kept reminding me that, Mom, we know what we want. And I think that is important. Please speak out and tell us what you want. It is not good for older folks to pretend that we know what you want, because there is always a generation gap. Whether we like it or not, we need to accept it. So speak out, exercise your right, put people that you can trust to deliver on their promises. Now, there are 4 areas that we think we need. Number 1 is data. You look at all the sectors, all the reports, the data gap is horrific. And yet governments and development partners are not investing in the right places to collect data, to tell us what is working, what is not working, what are people happy about, and what are people not happy about. Without those gaps, we cannot begin to count, and we cannot begin to hold leaders to account, including UN agency, and I can speak for WHO. I let Dr. Babatunde to speak for UNFPA. And then, of course, when I say that putting in place the right leadership is important, the right leadership must have the right policies. The policies are determined by the people, and at least through their voices, and priorities have to be done, and youth must be a top priority in the post-2015 development agenda, including the sexual and reproductive health rights, so many of you are championing and in your declaration. And I fully agree with you. Many people talk about the unfinished agenda of MDG. The whole rolling over of MDGs 4, 5A, 5B, and 6 is the minimum. And we should not allow people to chip away what have already been agreed. And of course, in order to deliver on your needs and your expectation, we need an integrated multi-sectoral approach. Because health is important, but what about education? What about nutrition? What about food and sanitation? That affect, your health and your well-being. Last but not the least, of course, the importance of, actually I said it as the first point, the youth themselves speak out. You remember Yvonne Chaka Chaka? She sang yesterday. What did she say? She said, let's talk. So speak up. Thank you.
Ms. Margaret Chan. I think that was a very inspirational. Going on to Ms. Kelly Thompson. We know that IFMSA has been working with PMNCH and has led a research which has identified youth priorities and their level of integration in the post-2015 discourse. From the research that you've done and having heard the discussions yesterday, what recommendation do you have for each of these global leaders here today about what they can do to support the prioritization of youth health issues? Please, like to make our time.
Thank you. So, as you mentioned, a lot of the material that is in the outcome document is actually based on a research project that we've been working on with PMNCH and some other organizations like YWCA. And the overall goal of it was to we know that young people have been saying what we want. We're kind of tired, actually, of saying what we want. And we wanted to go through and see if there's this kind of unification across what young people are saying, and of course there was. And then we wanted to see what's actually happening in the post-2015 agenda, and if the non-young people are actually listening to what we're saying. And throughout all of the different working streams, we found those same gaps. And they were sexual and reproductive health and rights, they were youth-friendly services, and they were around meaningful youth engagement. So I suppose my call to you is that yesterday actually Professor Babatunde was in our meeting and was saying that it would be great if we had a unified youth voice and to get signatures of young people to go forward with it, but I think we actually have to take it further and kind of echoing what you were saying about intergenerational leadership. And like I said, I was just in a meeting in Hong Kong about youth strategizing around post-2015, and the thing that came out from a lot of people was we're trying to speak out and we have a lot of things to say, but we're not feeling like our voices are being heard. And I think a key to making sure our voices is heard is that intergenerational leadership and having you guys take forward what we want and really pushing for it, because we are listening and we know when you're speaking out on our behalf, and we're really supportive of that, and we really appreciate it because you guys are obviously a lot more powerful and influential than we are, and we really need your support. And I mean, for particular examples, you spoke on data, and we also worked a bit on the adolescent health report, and I mean, a major issue was that there isn't actually age disaggregated data, so everything we're saying about adolescents could be completely wrong because we don't actually have the numbers to prove it. So for the WHO, an example would be in universal health coverage, monitoring and evaluating, making sure that we're disaggregating the data by age. And another thing was youth-friendly services I mentioned was really important, and I think making sure that it's clear to member states and countries what is a youth-friendly service and how does that look and how does that fit into healthy life for all. So I mean, that's what my ask to you guys is really to help us take our message forward, because we have the message, we've been consulted, we know what we want, and we really need other people to help us with it.
Thank you, Kelly. I think that's a very important point about how we really need to push this, and that's what Dr. Chan said. That's the youth ourselves. We need to make more noise at a country level and then move upwards as well. Ms. Amina Mohammed, we know that the ongoing research indicates that while youth are increasingly being asked to share their priorities for the post-2015 development agenda, these are not yet well integrated into the post-2015 discourse. What recommendations do you have for the youth here? We've touched on it in brief, but just your opinions in terms of what advice would you have for the youth in terms of ways in which they can increase uptake of their recommendations? And as special advisor, what are you able to do to help the uptake of youth priorities in the post-2015 development agenda?
All that in 3 minutes. Okay. That's where the age can't help. Again, you would do it in 3 minutes. We're going to take it a little longer, but hi everyone. I think that the first thing I heard today from you was your outcome document, the communique. And as I listed some of the things that are here, I would ask you to go back to what is being negotiated in New York and check on this list what's not there. The second thing I would say is that get some clarity around what is it that you should expect out of the framework that comes in September, and what is it you should be doing and engaged with after September. These are two very different things, and an understanding of them will clearly help you with the expectations you ought to have and the demands you need to make at each level. Because it is, as we negotiate that agenda, it is a set of goals that will come out. We will not be micromanaging or prescribing for country level, because someone just said here now, we need member states to understand what it means to be youth-friendly. Youth-friendly can be in the overarching document, but the implementation of really what it means to be youth-friendly, that's on the ground. So the first three things, one hopefully in each 3 minutes. The representation. I'm going to go past representation because we know representation has to be continuously improved. Not everyone can be at the table, but it's really helpful if you would build coalitions, because those voices have many colors to them, many faces, and they get through the door much faster than if we all try to be individual. There is strength in numbers, strength in those voices. We need to feel them. Certainly at the global level, there are many platforms. Use existing platforms and come in with them. But I tell you where we're missing the voices. We're missing the voices at the national level. There isn't noise at the national level within the sectors to get back to the international level to say, hey, what matters is what is happening here, and this is what we want to hear. There is what we have done. It's taken some time, but it was in Johannesburg it was born. Action 2015. Go look for it online. That is something we want to make work. It took time to get consensus around that, and the majority of people who spoke to it actually were youth. So we really need to get that going at the national level. There are a few places at the national level I think youth voices need to be heard on 2015. You have to write to your presidents. Ultimately, the presidents will sit in the General Assembly, and they need one big, strong paragraph in their speech at the General Assembly this year and next year, which talks to the issues of the youth, and then being up front and center for the next 15 years. If it's not in the president's speech, what did you say? What is measured isn't counted. What's not said doesn't matter. And so you really have to make sure you get that paragraph there. You need to speak to I'm talking to African youth here, and I think that you need to speak to the AU Commission Chair, Madam Zuma. She is big on women and youth. So get in there and help amplify the voices there. And then look at your parliamentarians. You don't have to go to every parliamentarian, try the speaker. That's what he's got a voice for. He's got to speak, so allow him, push him to speak for youth. These matter because each one of them has a voice in New York. Each one of them speaks to our agencies. Each one of them speaks to member states. So you really need to get them speaking with that voice first. There are new partners in this business, and everyone is, particularly in civil society, a little bit concerned about how they're going to take your issues. That's business. So you need to get engaged with champions in business who are doing the right things for youth. And then maybe with them we can begin to turn the tide. On communication, as I sit here listening, I know our modes of communication are different. Those that are in decision making today do not communicate the way you communicate. So we have a communication gap. And it's usually because you're far ahead in what you're using with social media. You're far ahead in the different things you say you want for yourselves, and what we think is best for you. We have to close that gap, and we have to be able to communicate better. And that's a challenge for us, but I also think it's a challenge for you. So it should be we trying to find a way to communicate better. And I've been saying this to business, I've been saying it to every constituency, because I find in my short stay at the UN, this is a major challenge, is that we're talking past each other instead of with each other. Finally, Margaret mentioned this, and implementation is where you're really going to be at. This is your career for the next 15 years. You're going to be doing the heavy lifting, so it's right that we hand over this baton and that we hand it over fully informed. But what I will say here is that the data revolution is the one that needs to happen. If we don't know where the issues are, where the people are, then we can surely not invest in them. And I think that needs to start happening now. We don't have to start waiting until 2015 to do that. There are things that we can start pushing for now. I'm going to stop here because I did promise to be in listening mode.
Thank you. I think that was very insightful. You brought up some issues I really hadn't considered. Thank you for that. Professor Babatunde, we have heard from the youth yesterday that equitable access to quality sexual and reproductive health education and services and ensuring rights is critical to accelerating progress towards the MDGs and to achieving sustainable development post-2015. What can PMNCH actors in this meeting do in their countries to promote policy priority and increase financing for youth and adolescent SRHR? What can UNFPA do to strengthen accountability for youth SRHR in the run-up to the MDG deadline?
Thank you very much, and I take it as a privilege that I'm the only man here. And I think the question you've asked is important not just towards the end of the MDG, but beyond. Let me give you a bit of stats. The maternal mortality figures in Africa today are high because adolescents die in pregnancy. And so young people are the ones who contribute a very large percentage of the adolescent mortality in Africa. And that is because they don't get information and education. So we need governments to accept, to provide quality, comprehensive sexuality education. It's such a basic requirement for young people. Young people in school and out of school. And I don't care what name is called. People argue about, comprehensive sexuality. It could be skills development. What we need is the information getting to people so that they can look after themselves. So that's the first. The second, of course, is that we need to open the space for young people to be able to access services. We talk about it and we say that young people can go to hospital and they can have this and that, but when they go there they confront this old woman who is from their community, who knows their parents. They don't go there, they won't go there, they will turn back and they go to places where they can get some friendly smile. And I think that what I have seen in Love Life in South Africa is what we need to duplicate and replicate million times around the world, so young people can talk to themselves, they can actually be their own counselors, and we can train them so that they can provide services for themselves. So youth-friendly outlets, youth-friendly services are the important thing. But more important is that we now have to hold governments accountable to ensure that resources are available for this. It's not enough to talk about it. We have to actually put money there. And we need to disaggregate the data in terms of countries to see how much money you give to health, how much money you give to reproductive health, how much money do you give to adolescent reproductive health. Because in most circumstances, that figure does not exist. And we just talk about it, but we don't know it. UNFPA has been doing it with countries, and we can tell you in many countries that it is totally insufficient. And so we would hold governments accountable to be able to do this and do it more effectively. If you truly, truly, truly want a generation of healthy adolescents in the post-2015, that's what we have to do. If you want to reduce maternal mortality here and now, that's what we have to do. And we must not shy away from the kinds of things I've talked about: comprehensive sexuality education, access to services, and making sure that young people can make choices in their lives to save their lives, not only from pregnancies and complications, but from HIV.
Thank you very much. That was very insightful. That's very good. Dr. Carole Presern, PMNCH has in 2014 also scaled up its efforts to focus on youth and adolescents, resulting in a strong youth representation in this meeting. What do you foresee as the future of PMNCH involvement in youth and adolescent work?
Thank you very much. I was actually counting the characters. I wondered whether I could do it in 140. I probably can't, but I'll make just 2 points because I think it's all been said. We have, as the chair of the Partnerships Board, one of the most powerful advocates in the world, alongside all these people here who are members of PMNCH. You can have your voice through people like this, but I would have rephrased the question, which is what can youth and adolescents do in PMNCH, rather than how it seems what we could do for you. We could have a youth constituency, we could have you embedded into all the constituencies, but in that speaking truth to power, I think that's what Amina said, you can help us do it in ways that they can understand, in language that they can deal with. So to do something practical, identify those gaps, bring it to the PMNCH board, and we will try and filter it right up to the very highest levels. Thank you.
I'd like now to open up the floor for anybody. If you have questions, comments, clarifications, additions, please feel free to do so. This is our time to interact.
So it's the issue of language rhetoric that's being used in the post-2015 development framework. One, I think sometimes it confuses the youth, but two, I also feel it's very important, since the implementation will be the heartbeat of the agenda, to unpackage the language. A good example is intimate partner violence. I don't believe that by the time your partner has beaten you to pulp, you can still qualify that relationship as intimate, let alone see them as a partner. So I think when we put the language in such a way that it confuses the youth, the implementation will also be a challenge. And also things like forced child marriage. Surely a child does not provide consent, so that's not a marriage. So it's illegal. We should package that language and address the language rhetoric in the post-2015 development agenda. And because you people are MDG advocates, we believe that you are committed to deliver on that, and so we believe that this will be addressed.
Just came away from the World Health Assembly in Geneva, and there was a document and also a resolution to talk about, violence against women, girls, and children. And exactly the point. One member state spoke out. Will you please delete the word intimate? Because you do not get all these problems just with your intimate partner. It can be with others too. So, and I support you, and I convince my member state to delete that word. Exactly. We don't use the right language that you understand. Thank you.
Let's be very clear. Words are used for emphasis. When you say, and my sister is excellent, when we went through the Commission on the Status of Women, trying to define violence against women, we had to ensure that we identify where the violence is coming from. And so, when you look at it and you come back to understanding that domestic violence is probably the most important, and it usually comes from the husband. That's why we insisted on intimate partner. Because if you don't do that, then it could be anybody. And I think that's the first thing. The second thing about first child, listen, let's not, it is also for emphasis. You see, when you say marriage is something you contract out of your own volition. So a child that is taken out at 10 and forced to go with a 62-year-old man is being forced. So it is for emphasis. Don't let's lose the emphasis. The emphasis is very important. Because if you don't do it, if you say the child gets married, and there are cultures that tell me that it is okay to marry a girl at 10. No, it is not. And so the first is for emphasis.
Several policies have been said, like we said yesterday, that there are no new policies again. I said nothing new. It's like everything has been said. And in the place of implementation, especially at the grassroots levels, I want to say, because we discussed yesterday there's a divide between rural and urban areas. I want to ask leaders, how do you want to ensure that the young people at the rural levels get to access some of these services? Because I noticed that sometimes when you are bringing a new policy, it goes through existing health programs, like through the state government, through the local government. And oftentimes when these programs are being implemented, the rural youth don't get to access them. They don't get to. There's a divide between the urban and the rural. Like talking about social media and also the youth in the rural areas don't have access to this. So I want to say, how do we get to reach the grassroots youth at the rural levels? Thank you very much.
Teenage pregnancies, what do you think would be the most effective way to reduce this? Because that seems to be the most dangerous one, both from, particularly from the health perspective, I mean. So how do you think that can be addressed effectively so that it comes down sharply within a few years?
I'm strained because my boss is moderating. I'm Nyaradza with the Worldwide WCA, and Itsunge is my boss, literally. So I'm just raising this in terms of how can we trust young people to lead? Because at times we think young people should participate, be involved, but not be trusted to lead. And my boss can do my performance evaluation and fire me. So I think the question is, how can leaders trust that young people have skills to lead and not just to inform? My second question is, as the recently appointed African Union Goodwill Ambassador on ending child marriage, I find one major issue that decisions like post-MDG would be negotiated at the technical and the political level. So the political level includes ministers of foreign affairs and heads of state. And the young people that we work with have very limited access to those ministries, to those heads of states. What can you do to support us and the young people to access the ministries of planning, the ministries of foreign affairs, for that dialogue to happen? I think today is what you have done today is very exemplary. That before a major forum, you start to meet with the young people. In many instances, there's no quality dialogue like this, of just having a dialogue. So thank you so much for setting the precedent, setting the tone of quality dialogue. But we also want to have that at country level with the ministers of foreign affairs, with the ministers of planning, and with the heads of states before they come to New York or wherever for the negotiations. Thank you.
Thank you. We'll take one more question.
Hi everyone. My name is Shabani from Tanzania. I have one question, and it's always disturbing my brain. We normally hear leaders, they sign a number of documents. Every year we hear the same documents and documents and documents. And they even come up with very good policies. But when it comes to the implementation, there's a very, very big challenge. For instance, where I'm coming from, if like I say, I want to organize the dialogue, youth dialogue, then they'll be asking like, what's the youth dialogue for? What do you guys want to do? You know, so they think maybe behind there's a political issues, you know, and that's a very big challenge. So we'd like to know, especially you from when you meet with our leaders, you know, assemblies, wherever, what actions do you always take to make sure that what these leaders sign, they really implement in their countries?
Thank you. I'll give everybody 1 minute, and please let me.
She's a very sharp leader.
Implementation, and implementation. I think we are hearing from you. I mean, yes, you have policy, but the gaps are implementation. And of course, you know, especially the hard-to-reach population living in rural. This is actually our common challenge, not only for services for the youth, for immunization, it's the same thing. The hard-to-reach 10 to 20% are really the ones that are most in need, what we call the inverse care law. Those who don't need the service get the most service. Those who need the service do not get the service. We really need to crack that nut. Yesterday in my bilateral meeting with Gresha Michelle, she reminded us again and again and again. It's the implementation challenge. So we need to take it on board and look at that. Teenage pregnancy. Educate girls, empower them, keep them in school for as long as you can. And girls, women are the best agents of change. No question about it. Now, 1, 2, 3, 4. How can you trust young people to lead? Excellent question. We were young once. We were given an opportunity. Don't be afraid to engage young people. Yes, we do make wrong judgment at times. We may make mistakes, but we need to learn through that process. Another thing is, too many old people don't want to leave their job. They keep staying on. Don't allow that to happen. Young people must be given a chance, including allowing them to make some mistakes and learn.
Thank you. I'll now give a chance to Ms. Amina Mohammed to speak, then we can give.
Thank you. Very quickly, and tell me when 1 minute is up, otherwise I'll keep talking. On the implementation part of this, I think it's important that the new agenda emphasizes that we're talking about all. MDGs talked about percentages by half, by 3/4. We're saying everyone, leave no one behind. And that, I think, is a different emphasis on getting down to the grassroots. It means that we will have to plan better. It means we have to be involved in the planning. So where those spaces are opened, we should make sure that we're inside them. And again, as Margaret said, the data revolution is going to be important. The goals you will see will be global, but the targets have to be actionable, and we have to see an investment behind them. If those targets don't speak to action and they don't speak to a budget line, they're not going to make a difference when they get down to the country level. So I think, advocate on that. The second about trusting and access. I think it's important that each one of us continues to talk in the fora that we see leaders, the importance of having young people there. Two things that I can say that we've done in the last couple of months. We have a new president of the General Assembly. He comes from Uganda. What he has promised to do is to ensure that young people will be involved in all of his events, and he will ensure that the openings to this discussion, when we say civil society, we don't just look at old civil society, we also look at young civil society. So we begin with him. He is the President of the General Assembly at a time that is going to be extremely important for this. But also World Economic Forum. When we wanted to speak to them about business, we asked for the shapers, the young people there who are in business, like you're a young doctor. We also had them around the table. The things we heard from them are different from the things we heard from all business people. So that was an opening, and member states appreciated that, and I think that that's important. The trust, as Margaret said, we were once young. I think start, from the relationships that we have, certainly with my children, I'm 6, and every day through that range, we learn to trust each other better. So let's use it from the home out.
Totally agree with Margaret. If you want to stop teenage pregnancy, you want to stop it by keeping girls in school and making sure they stay in school until at least they're 18. But it's not just keeping them in school. It's teaching them about who they are, comprehensive sexuality education, and give them access to services. Let them make choices whether they want contraception or they don't want, because that's what's going to make the difference.
And I'll just say, if you haven't signed up for My World 2015, this is a survey that asks your opinions. 74% of the 2 million that have signed it have been young people. It's different for every country. Use your voice. This is your moment to tie your big issue to the global challenges and hold your countries accountable. Thanks.
Make sure everyone in the world has a birth certificate, then they can't be married off at age 10.
Thank you all for coming.